right, so gather around, y'all, gather around. All right, ladies, the exhibit is now closed. Y'all gotta move on. Thank y'all for coming. There is no prize for being in the back, y'all. Press on in, press on in. All right. Hey, listen, welcome to Jurassic World. My name is Jimmy the Dino-Man. I am a Jurassic World park veterinarian, and I am a park ranger at Jurassic World, all right? I'm gonna talk to y'all a little bit about some of the commonalities between running a major theme park with exotic animals and running a hospital. And believe me, y'all, there are some common similarities, all right? First and foremost, most important thing you need to know is that it's about responsiveness, right? At Jurassic World, we have to be responsive. I'm gonna ask y'all to be responsive here, okay? Now listen up here. One thing I want y'all to know is that everything I'm gonna talk to y'all about today is about safety first. Safety first, all right? Now there is a service aspect to it as well, but it's mostly about safety. Now I want y'all to take a second, all right? Karen, welcome.
Sorry.
Oh, it's all good, Karen, it's all good. Karen, the show don't start till you arrive.
Okay, there you go, thank you.
All right, guys, I want y'all to picture a big, beautiful stegosaurus. She's a beautiful animal, ain't she? Big, beautiful stegosaurus. She's got that long tail with them 3 horns on the end of it, right? Perfect, all right? I love a stegosaurus. That's a beautiful animal, right? Now, I want y'all to picture what would happen if she got out of her enclosure, right? She's running down Main Street. Well, I'm going to tell y'all, every employee at Jurassic World, we are trained to respond. We're going to hit an alert. Beep, 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 right? We're all going to know that when we hear that alert going off, we need to go and check on that stegosaurus. And guess what? Your patients, they also have some alerts as well, right? First and foremost, they've got their call light. When a patient needs something, they hit that button, they're telling you, I need you to come check on him, right? So just like that stegosaurus, we all want to rush and check on that patient when we see that alert going off. Second way that they have to alert us is their Biz Alert, all right? And that Biz Alert is going to count down and it's going to hit 0 and turn red. That tells us a member of our care team needs to step on up and come check on that patient, all right? So I'm going to ask you guys to think about that. Now, can we prevent those alerts? Absolutely we can, absolutely we can. I'm gonna ask, first off, I'm gonna talk to our care team, right? Our nurses, our patient care assistants. I want y'all to listen in first. You guys do what we call purposeful hourly rounding. Now, when you do that hourly rounding, I want y'all to address something important, the 4 Ps. Who can tell me what the 4 Ps are? Position, very good. Pain, potty, and possessions, all right? And if you work in our emergency department, it is also planned. Now, we're gonna address those 4 Ps because I want y'all to think about this, right? Why do patients fall? They fall because they get out of the bed, right? They get out of bed to get their stuff. They get out of bed to go to the bathroom. That's why patients fall. So by addressing the 4 Ps, we're already impacting safety in a positive way, just like we would do with our beautiful stegosaurus. When I walk in there, I make sure she has everything she needs before I leave. All right? Now, some of you may say, like Barbara here, well, I'm not a nurse or patient care assistant. What can I do to help prevent problems like that? Barbara, that's an excellent question. Thank you for thinking that. Very good. All right, so here's what I want y'all to do. If you're not a nurse or a patient care assistant, if you're visiting a patient, or maybe you just brought them back from a procedure and you're leaving them there, ask a few questions like, do you have any questions I can answer? Before I leave, is there anything I can get for you for your comfort? One thing that I want every one of y'all to promise me you're going to do when you visit a patient's room before you leave, ask them, do you have your call light for your safety? That's important. Make sure they have their call light. That is their lifeline. That is their lifeline. I would not leave that stegosaurus enclosure without making sure our alarms are set. Make sure your patient has their call light. All right. All right. And finally, ask them, is there anything that you need me to escalate to your nurse or to your patient care assistant? That's your way to be that patient advocate. Hey, I put this on, I'm telling everybody that I'm here working and taking care of dinosaurs. You put that on, you're taking care of patients. No matter what you do in our facility, you're taking care of patients. Guys, let's say that we've done all of our preventive methods, but this call light still goes off. What should we do? Well, first off, I know that that call light can be a little intimidating. That ding, 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 ding with that bright light, that's a little intimidating. It's okay. It's all right. I promise you're a professional. You can handle it. So what I'm going to ask you to do is I'm going to ask you to knock on that door. Walk on in, and I want you to use your good AIDET skills. Now, AIDET stands for acknowledge, introduce, duration, explanation, and thank. Think about this, right? That beautiful stegosaurus is running down Main Street. I'm going to listen to what the park visitors have to say. I'm going to listen to what they tell me. I'm going to be engaged in the moment. I want you to do the same thing with your patients. Be engaged in the moment. Listen to what they have to say. Hear their concerns. All right? Don't be afraid to introduce yourself, all right? Because that speaks to your credibility. I told you I'm Jimmy the Dino-Man. I'm a park veterinarian, right? That tells you I know a little something about dinosaurs. You are the expert at what you do. You are the expert at what you do. When you use your title, you tell them who you are, you introduce yourself, you're saying I'm an expert and you can trust in me. All right? So do that for your patients, all right? Make sure that you use good duration and explanation. I'm going to tell you, if that beautiful stegosaurus is running down Main Street, People are going to know what they need to do and when they need to do it. Do the same thing for your patients. Let them know what's going to happen and when they can expect it and how long it's going to take. Provide them information. And finally, thank you. Hey, y'all see my beautiful girl right here, Jurassica? She's a beautiful, beautiful T-Rex, right? Well, when I work with Jurassica, I make sure I use simple commands that she can understand. All right? That's going to keep us both safe. When you work with your patients, I'm going to ask y'all to use simple terms they understand. Think about this, right? You guys know your keywords? Is there anything more simple than your keywords? Give me a keyword. Comfort. Very good. Give me a keyword. Privacy. Give me a keyword. Safety. Give me a keyword. Okay, there's more than 3 keywords, but good, good. Hey, listen, your keywords, guys, safety, comfort, privacy, always my pleasure. Think about this. Every single patient knows what safety, privacy, and comfort mean, right? That's a simple term, and it's something that's important to them. We want to show it's important to us by using them terms, right? And when I work with my buddy Scout here, my beautiful pterodactyl here, now he's a little moody sometimes, so I make sure I'm always consistent. I do things the same way. When we use the term always, we're telling them we're consistent. We're going to do it the same way every time. We always take it serious, all right? All right. Now, once you walk inside that patient's room, do not be intimidated, because no matter what you do in our facility, you are qualified to take care of patients. Because every single one of you, no matter what you do in our facility, can get a blanket. I bet you didn't know that. I bet you didn't know you were qualified to get a blanket, but you are. You just did that. Congratulations. You know what? I bet you can ask somebody who does. Every single one of y'all who walks into a patient's room is qualified to move a tray table or telephone closer to that patient so they can order a delicious lunch. Every one of y'all is qualified to do that. Every one of y'all is qualified to pick up the old tray and put it away or clean up some trash. Now, there are going to be some things maybe Barbara's not qualified to do. Barbara probably shouldn't be taking a patient to the restroom, right? Probably not, right? In that case, you're definitely going to escalate that to the patient care assistant or to the nurse. Things like questions about pain or medication, right? Those are things you can escalate, right? Things about their plan. But if it's something you can take care of it now. Because Karen, you've been a nurse a long time, right? Right? Not as long as Scout's been alive, but a while, right? And in your experience, have there ever been moments where you were with a patient maybe for like 30, 40 minutes while another patient's calling you?
Yes.
Yeah, why should a patient have to wait 40 minutes just to have their tray table moved? They shouldn't have to do that, right? Those are things we can all take care of, right? So guys, if we do these things, we're going to see this responsiveness score going on up. And hey, look, we are currently above the national average, all right? But if we keep moving on up, keep doing the right things, we're going to see it rise. Now, I know y'all heard Lori say, give Lori a big round of applause for saying it, by the way. I know y'all heard Lori say that we're going to get a patient satisfaction bonus. That is awesome. That is amazing. Any of y'all going to use it at Jurassic World? No? All right. All right. Hey, listen. That patient satisfaction bonus is nice, right? But that's a threshold bonus. Don't y'all want some superior money? How do we get superior money? By doing all of the things that we've talked about here today consistently. If we do them consistently, we're going to move on up. Because look at our scores right now, guys. Our emergency department for the month of July is in Superior. Superior for the month of July. Inpatient, right? Look at this. June and July, we are above target. Look at our outpatient group. My goodness, they're above threshold for the entire year. That is amazing. And AmSurg has got some good numbers. We keep doing these things, guys, we're going to be in that superior range. Right? Don't our patients deserve it?
Yes.
All right. Hey, listen, I want to thank y'all for joining me today. If you guys feel like you can be responsive, y'all are welcome to take one of my last few baby dinosaurs. These are the babies, all right? Scout is not a baby. Do not take Scout, but you are welcome to take a dinosaur, all right? Like at every major theme park, you are also welcome to some ice cream. However, I'm going to ask you to only take one, otherwise Eddie has to pay for it. Okay, so just one ice cream. And finally, who wants some World Championship Astro socks? All right. Let's see that. Here you go. Socks for you. You get a pair. You get a pair. You get a pair. Georgina gets a pair. Thank you so much. Hey, y'all, thank you for joining me. Take your golden tickets. I want y'all to put them in the bag. I can't promise a lifetime supply.